We have much dissatisfaction in our healthcare system, and it's not new that the World Health Organization only ranks the United States 37th in the world and 19th or last of industrialized countries in overall quality of our healthcare. Now, this is in spite of our sophisticated technology.
Yeah, it's hard to believe, isn't it? You'd think we'd have to be higher than that, but clearly we're not.
Well, we have an epidemic of chronic disease and 1 million deaths per year from medical complications. Now, we need to do something about this soon. So, we thought that it would be a good idea to start by just going over the history of healthcare in the United States to better understand how this happened.
Right. See, healthcare never was as complicated 60, 70 years ago. Because when people got sick, they mostly stayed home, took care of themselves. They didn't go to the doctor because it cost too much.
And the doctors would come with their little black bags.
Exactly, like Dr. Wellby, Marcus Wellby, remember that, and Ben Casey, and
Dr. Kildare.
Dr. Kildare. They were all people who were really dedicated and devoted to their patients. They're the kind of person you'd want to have to take care of you because they're so concerned. And yet things have changed. And now the best example of a really modern great doctor is probably Dr. House, for those of you who watch much TV. And he's got the same kind of bedside manner, except now we have all this technology added to it. But it's not practical in America to really be practicing that way because we don't have enough time to be like that anymore. It's gotten out of control.
Well, how did we get from healing to science and technology?
Well, that's a really good question. I think that what happened is the medicalization, okay, of the United States started back sometime during about World War II. And what happened is there was a price wage freeze. And that meant that you couldn't increase wages. And so corporations wanted still to compete for people who would work there, and they wanted to improve the amount of money they could give. So what they did is they gave them health care benefits, not insurance, health care benefits.
So what's the difference between benefits and health insurance then?
Yeah, big difference. If you have health insurance, that's to cover what you can't pay for yourself. But a benefit, that's something you deserve because you've paid for it and it's a service.
So it's an entitlement.
It's the perfect word is entitlement. Exactly. So that's what we have today, and it's gotten out of hand because now we have a business that's managing healthcare. It's like the tail is wagging the donkey.
Yeah, and it's just become this big business where the costs and the profits and everything are what's driving it instead of really just taking care of people.
Well, that's right. Now we spend now 18% of the gross national product. That's 18% of every dollar generated in this country. 18%, huge number. It's about $2.8 trillion. And we spend about $8,000 plus per person per year for health care. And in return, what we have is a very sophisticated healthcare system that for the wealthy people who can afford it, it's the best healthcare system in the world by far.
So in order to make these health insurance profits, one of the things that they've done is that they've started creating diseases.
Well, that's
So
right.
we have osteopenia, which is still within the normal range, but it's
Right.
like before you would maybe get osteoporosis.
Right.
And then pre-hypertension and
Pre-diabetes.
pre-diabetes and all the rest of that. So they're creating all this to make money.
Well, that's right. So what we have is a necessity on the part of the insurance companies and the pharmaceutical industry and the rest of the medical industry to try and make as much profit as possible because these businesses are responsible to stockholders. And that means return on investment is the bottom line, not patient service, not patient satisfaction. Although if you can do that, that's fine.
Well, then the doctors didn't really want to get involved with the finances, so how did the HMOs come about?
Well, that's an interesting story. See, back in the late 80s and early 90s, doctors finally were up to here with worrying about the cost of health care. What we wanted to do was take care of people because we're interested in their health and in making them well. And so cost wasn't a factor we wanted to consider. So we told the rest of the medical industry and people who were managing the finances, you take care of the finances. We want to take care of people. And so we let go of the purse strings of medicine. And now what we have is big organizations, hospitals, HMOs, organizations like Kaiser Permanente, dictating how healthcare is going to be
So
practiced.
they all have the power and the control over the doctors even.
Exactly. So if I, as a doctor, want to prescribe a certain treatment, I may be talking to some administrative person who says, well, let me see, I can look at my little book here and see whether or not this is approved. Oh, I'm sorry, doctor, it's not approved. What do you mean it's not approved? Well, that kind of outrage is what we go through, but we did it to ourselves because we wouldn't take that responsibility when we were in the 80s and 90s to look at healthcare costs. I mean, who could be better qualified than a doctor to be able to regulate healthcare costs?
So now the doctors are employees.
Exactly. And what we've got is policies like one size fits all. We've got affordable health care, which is going to be tracking everything we do. And if we don't do everything that is according to the book, first, we won't get paid. Second, we'll be reprimanded and probably fined. And third, there may even be legal prosecution that sends us to jail or loss of license. So we're in deep pucky because of that one little thing.
So we spend more money and we get poorer care. We're treating symptoms instead of causes.
Right.
Because it keeps it going with the economy.
Right. So we need to wake up and do something about this as a citizenry of the United States. And the way we can do that is by trying to stay healthy instead of feeding into the sick care system. You got to stop listening to those direct-to-consumer ads that tell you that you need this particular drug or that particular
maybe
procedure.
do listen to some of them. I mean, listen to
Too
the side
carefully.
effects at the end. Yeah. Don't just block that out and say, oh, that could never happen to me, because it can.
So what you can do is you can take responsibility yourself for a healthy lifestyle, because there's no more powerful medicine in the universe. It's diet, exercise, stress reduction, sleep, weighing what you should, avoiding toxic exposures, and having a meaningful purpose in your life. If you do that, you'll undermine what's happening with this competitive business, this medicalization of America that's taking us down a path that's getting us in lots of trouble. So the buck stops with us. We can do it. And if we want to be healthy and we want to have enough money to run our lives in this country, wellness and prevention is the tool that we need to embrace.